Another breakthrough in the fight against COVID. Children as young as 12 are now eligible to start getting the COVID vaccine as the FDA expands emergency approval for Pfizer.
So here's what you need to know. The dosage for kids 12 to 15 will be the same dosage that adults get. They'll get the first shot followed by a second dose 3 weeks later. As far as safety goes, Pfizer just released its study results in late March.
They found the vaccine is 100% effective for this younger age range. Out of the 2,200 participants, there were no positive cases among those fully vaccinated.
NBC's Dan Schuneman has more information on this huge step towards stopping the spread of COVID. Plus, we hear from health experts with the FDA.
The Food and Drug Administration says Pfizer's COVID-19 vaccine can be used to inoculate children as young as 12.
Having a vaccine authorized for a younger population is a critical step in continuing to lessen the immense public health burden caused by the COVID-19 pandemic.
More than 2,000 volunteers were used for testing. The FDA study found the vaccine was safe and offered strong protection. 17 million children will be eligible for vaccination.
Though one can say that often children don't get terribly sick from COVID-19, there are kids who do get very sick from it. And in addition, they can bring it asymptomatically around to their grandparents and others.
Some 15,000 pharmacies and some schools will offer doses.
The kids are the ones that are more out in the street or in public, and there should be the ones that be more safe.
The final hurdle, a CDC advisory committee. It's expected to make a recommendation on Wednesday. Dan Schuneman, NBC News.
The FDA's approval of the Pfizer vaccine has official warning parents to not neglect other important vaccinations for kids as well. On top of COVID, doctors say diseases like measles and whooping cough can also be deadly, and kids should be protected. Experts suggest waiting at least 2 weeks after receiving a second COVID shot to get other vaccines, though. And that's why doctors want kids to get those vaccines now so they don't have to wait later.
Well, the Indianapolis City Council has voted to keep current COVID restrictions in place. The council voted last night after state lawmakers overrode the governor's veto on a bill impacting local health orders. With the city council vote, everything is staying the same when it comes to masks, social distancing, and capacity limits across Indianapolis. More details on that vote from the State House. The Republican-controlled Indiana General Assembly voted to override Senate Bill 5.
The measure requires local health departments to get approval from elected officials before imposing public health restrictions that are more severe than state mandates. And opponents, including Governor Holcomb, say this could jeopardize the agility and flexibility local officials need in a crisis. The lawmaker who wrote the bill insists it creates necessary checks and balances.
Now, Governor Holcomb sent us a statement saying, in part, "I would have hoped that such sweeping change could wait until we gathered all the relevant experts and stakeholders to strike the right balance regarding local health authority during emergencies and avoid discouraging laudable service in the field of public health, especially knowing that it's locally elected officials who appoint the local Department of Health board that hires the local health director in the first place."